You may be surprised by a new report from the Fortified Health Security, and it's outlining some top cybersecurity problems in healthcare. Actually, come to think of it, I'm not surprised to find that there is poor risk planning, weak supply chains, outdated systems, missing inventory records, and a lack of training in health. Um, these issues are connected to and have been exposed in major breaches like the 2024 Change Healthcare attack. Despite the risks, the report shows that some progress has been made in fixing old systems. Hmm, I wonder how much. Planning for incidents and improving leadership and identity security. The findings are based on data from 2023 to mid 2025 across various North American healthcare organizations. So, supposedly the finest healthcare organizations in the world in your US system. And yeah, this seems like there might be a lot of old, archaic systems still in play in healthcare in the US. Dom, is it looking after your health well?
Right now? Yeah, for the time being, I guess. Uh, you're right. We do have the best healthcare system that money can buy that then immediately takes all of the profits and plows them back into shareholder equity, which will turn out to be one of the three great lies of the modern industrial revolution area. But let me tell you why one of these things is the hospital's fault and one of them isn't. Obviously, the hospital's fault is that they're not upgrading their systems because why would you spend money on IT when you could give it to people who really don't need it? That's one of the problems of operating a for-profit enterprise like healthcare. I mean, I don't want to cast aspersions, but why is it that most every other country in the world operates healthcare like a basic human right and not a business? That's a discussion for a different podcast. But the fact is that most hospitals are running on older equipment, at least from an IT perspective. When we need a new MRI machine, we'll order one of those because we can charge for that. But the wireless network and the cabling plant and the firewalls, we can't charge the customers for that, and so those get best effort. The other thing that I think has kind of been a maybe not an explicit thing as of late is this idea that we don't attack hospitals, right? Think of the Geneva Conventions. We don't shoot churches, we don't shoot hospitals, we don't bomb Red Cross trucks. So I think that what happened was is that hospitals just kind of assumed that people were going to stay from out of there and not hack them and try to steal patient records and cause other outage problems. Surprise, hackers don't care about your Geneva Conventions. And so hospitals are very tempting targets because they're very large enterprises with very short stabs and very old, outdated equipment. They are very tempting targets. And once you get in there, you can cause a lot of havoc. And better yet, all those profits that they have that they're trying to give away to the shareholders. That means that you might be able to lock up some systems and encrypt some data and get the regulators on your butt if you don't pay us to unlock all of it. That's right. Hospitals do have a tendency to pay ransoms and other kinds of extortion fees. So here's a thought for all of you hospital IT administrators out there. It might be time to invest some of those profits in keeping yourselves out of the news and out of reports like this. I mean, we're not going to get universal health care in this country overnight, but maybe we could keep people from dying because folks don't know how IT works.